If they're not 20/40 in the better eye, then a patient must be 20/60 or better in both eyes. One of the questions that I get asked most frequently is, can I still drive? So one of the things we need to know is, what are the state laws in Tennessee in regard to driving with or without visual impairment? So if an individual isn't able to pass the vision test at the DMV, then they would go to their eye doctor. At that point, what we're looking for is a patient must be corrected to at least 20/40 or better in the better seeing eye. So that means that if one eye doesn't see well, let's say it's 2200, then the patient would need to be 20/40 in the other eye or better. If they're not 20/40 in the better eye, then a patient must be 20/60 or better in both eyes. If an individual doesn't meet that criteria, then we start discussing the eligibility for driving with Bioptics. So with Bioptic Driving, what that means is a patient has to be at least 2200 or better in each eye through what we call the carrier lens. So the carrier lens would be the patient's regular prescription, so the lower portion of the lens here in this pair of glasses. And then the patient would be able to see at least 20/60 through the Bioptic Telescope. So the Bioptic Telescopes are what are mounted at the top of this pair of glasses. So the patient has to see 20/60 or better through the Bioptic with no more than a 4x telescopic power.